Welcome to Tiny Teaching Topics with Robin LaCrosse, essential conversations to have with your kids about sex. In today's episode, we're going to be talking about everything you need to know about HPV to keep yourself and your children safe. The important thing to know about the human papilloma virus, also known as HPV, is that it's a sexually transmitted virus, and it puts you at risk for cervical cancer, and it puts your male partner at risk for oral and throat cancers. What you may not know is when you go to your physician to get tested for STDs and you request the whole complete panel of STD tests, you're not being tested for HPV because the physician isn't offering any test for HPV beyond what's available in the pap smear. In this video series, we're going to be talking about what HPV is, how you get it, what it does, why the concern, and part 2, we'll be talking about HPV testing. There have been some new developments and advances that you'll want to know about, especially if you're single and dating or have children who will be. And then the third segment is about the HPV vaccine and parents who have to make decisions regarding vaccinating their kids or not should find that very interesting. So I hope that you find this 3-part series useful. This episode is brought to you by Holistic Sex Ed for mothers raising empowered daughters.
Let's talk about HPV. This is a super duper magnified image of the HPV virus number 16. So this particular little virus right here is responsible for the majority of all cervical cancer. Not all of it, but definitely a huge percentage of it. So what is the human papillomavirus? It is a virus that causes warts. However, not all strains of the virus actually produce warts. There are about 200 different strains that affect the human body. And the number I've seen is about 37. Usually there's a range between 30 and 40 when you see it like written places, but I had the opportunity to actually count how many strains there were being tested for in this one particular test, and they were checking for 37, so I thought that was interesting. So there's a lot of different strains of this particular virus, and definitely not all of them affect the genitals. You know, the wart that you get on your hands and feet, that's HPV. You may have seen the documentary about the Elephant Man. He's got HPV, warts taking over his body. It's just terrible. So yeah, when your immune system is compromised, HPV can really be a problem, and that's what happened in the Elephant Man story. But so most people who have HPV don't actually know that they carry the virus, men in particular, and it's not their fault because there is no test for HPV in men. And we're going to talk about this in greater detail about the testing for HPV, but there is no test being offered for men to test for HPV, and there is for women. We'll get into it more in a little bit, but it's kind of tricky. You have to ask for it, different things. So we'll get more into that. And Planned Parenthood has said approximately 70 to 75% of the sexually active population has been infected with the human papilloma virus at one time or another. They may not be positive for it right now because some say that the body can clear the virus, so we'll talk more about that. But that's their estimate. And there really hasn't been good data on HPV, but there has been some interesting facts and figures that have come out recently, actually this month, in fact. So I had no idea that they were going to put out this information, so it was actually really great timing. So how do you get HPV? Well, intimate contact, including unprotected sex. So HPV is a sexually transmitted virus that spreads through unprotected sex, and even if you use a condom, you still may not be 100% protected because the virus spreads by skin-on-skin contact. So with a condom, you're covering the shaft of the penis, but not all of the area that actually has contact when you're having sex. So that skin-on-skin contact, you can cause transmission of the virus. It's not like we're having sex through a bed sheet with the condom, like attached to it or something. So there's definitely some contact going in there. So at least with a condom, even if you're not getting 100% protection, and this is my own theory, it's not based on science or anything like this, but I feel like if you're using a condom, you're not depositing the virus like right next to your cervix. So I don't know how well it travels through the tissues or the environment, how fast it spreads when, I'm sure if you're familiar with viral biology, the virus infects a cell, it replicates, the cell gets sick and dies, and when the virus is replicated to the point where it can't hold anymore, it explodes, and all these little new viruses are released into the surrounding area. And how far they spread, I don't actually know. That would be a great science question for science to explore. But so in my theory, in my mind that I totally made up, my thinking is at least, if you're wearing a condom, it's like you have at least the space of the vagina before the HPV gets to your cervix. You can also get an oral infection of HPV through oral sex. They've been noticing, the scientists and the doctors have been noticing an increase in oral and throat cancers being associated with HPV, and men in particular are at risk. Men seem like they're getting a higher rate of oral infection than women, and the recent studies that actually just came out this past month were talking about that. So our guys need this information too to protect themselves. So what else? Unprotected anal sex, of course, can also put you at risk for anal cancers. They've been noticing an increase in HPV-related cancers. So there are different ways to get HPV. I don't know if you can get HPV from an oral positive person to like an oral negative person, if they can transmit it. I'm going to assume probably. So, it might be good to know, what people are infected with. Unfortunately, we can't test for that. At least the doctors can't right now. So, something else I just want to point out, too, is if you have children. A lot of kids these days are engaging in oral sex and also anal sex. But oral sex in particular, girls especially giving oral sex to boys because they think it's safe. And really, the safety is that they can't get pregnant. It doesn't mean that you can't get a sexually transmitted disease, and kids may not know that. So that might be something that you want to definitely include in your conversation about the risk of oral sex, because it's becoming very, very common for girls to give oral sex to boys. It's a way to get out of having sex. It's a way to make them happy. Big, long story, complicated stuff that goes into that whole dynamic that's happening in our culture right now, which we don't have time to get into today, but could be a conversation for another time. So what happens after you've been exposed to HPV? So once you've been exposed, there's three important factors that come into play. One, the strength of your immune system, the state of your overall health, which also impacts your immune system, and also which strains you were exposed to. So with those three factors taken into consideration, one of 5 things might happen. Your body might fight off the virus, and you'll never know you had it. You might get genital warts, depending on what strain of virus you were exposed to. The virus might begin affecting your cervix cells, and a pap smear might come back as abnormal within about 4 months. There's about a 4-month incubation period for the HPV to do its thing to the cells, and then, you know, those cells have to, you know, turn over. So there's about a 3-month turnover rate for cervix cells. So it does take time to incubate. The virus could also be present, but the immune system might keep it in check. So again, you won't know that you have the virus. And really the only way you actually find out that you have the virus is if your pap smear comes back as abnormal. So the virus has the potential to lay dormant for many, many years as long as your immune system is healthy, and it can hide out in the tissues and, you know, that kind of thing. So if your immune system just kind of keeps it in check, it lays dormant, but it might become active again, like if you go through a period of intense stress, you know, something that knocks your immune system down, that's when the virus tends to manifest. So if you've had like a crisis in your life, you know, it's like, and if you have a history of HPV or abnormal pap smears, you might want to just go get checked out if it's been a little while, you know, because we'll talk more about the virus hiding, ability to hide, and whether it can go away and that kind of stuff. I just want to stay on track, but we'll get more into that. So cofactors that increase the risk of HPV infection, when you're exposed to the virus, if you have certain things in place in your life, like lifestyle choices and that kind of thing, that could put you at greater risk. So like if you're a smoker, you smoke cigarettes, the nicotine and the other chemicals that are in cigarettes actually negatively affect your cervix cells. If your partner smokes cigarettes and you have sex without a condom, the chemicals in the nicotine and the cigarettes, they go through his semen out into you if he ejaculates inside you and can impact your cervix. So the whole smoking and the chemicals are related to that. Definitely not a good scene if you want to avoid having problems with your cervix. So drug abuse also knocks down the immune system and puts you at greater risk for HPV if you're exposed. Nutritional deficiencies also can increase your risk because the cervix needs certain nutrients to stay healthy. And if you're curious to know more about that particular topic, I have another webinar that's about cervical dysplasia and HPV. So it's more based on like after you've had like the positive diagnosis and the problems that causes, and like things like the nutrients that you need in order to have a healthy cervix. And so it really goes into detail, you know, on that level in that other webinar. Again, not time to cover everything here today, but that's definitely another subject and also webinar that you might be interested in checking out. Immune deficiency, again, if you've got an immune system that's been beat up or depleted for whatever reason, maybe you just don't get enough sleep, you know, you don't eat well, whatever, you know, all those things take their toll on your body, on your immune system. So if you're in a kind of a run-down state, again, you could be at greater risk if you're exposed to the virus. Oral contraceptives, hormonal birth controls, can increase your risk of having problems with HPV infection and also cervical dysplasia. Another kind of phenomenon that happens when people are on hormonal birth control, even like teenagers and that kind of stuff, because their main fear is not getting pregnant. They're not really like putting the connection with STDs necessarily, and so when they think, oh, I'm on the pill, I don't have to worry about getting pregnant, you know, it's like we don't have to use a condom. Actually, yeah, no, you want to use the condom. So again, by not using those condoms, women are putting themselves at greater risk for picking up these viruses like herpes or HIV or HPV, which we're talking about today. If you're 18 years old or younger and you start engaging sexually, like having sex before you're 18, that also increases your risk. And also if you give birth before the age of 22, that also increases your risk of having problems with HPV if you're exposed. Symptoms of an HPV infection. Guess what? There are none. Unless you get a strain that causes warts that you can see with the eye, which some of them you can't see, but the ones that you can see with your naked eye, those are the only symptoms that you'll get from HPV. And the ones that cause, the strains that cause warts are not the ones that you have to worry about. You may be infected with more than one strain, so that can send you a flag to go get checked. But the strains of the virus that cause the most problems with your cervix are the ones that do not cause any symptoms, any visible things that you can see. It's like a completely silent infection until you go and get your pap smear and it comes back abnormal. Or if you're one of the people who doesn't go get pap smears regularly, I know a lot of low-income women will tend to neglect pap smears just because, it's super easy. If there's doesn't seem to be a problem, why go and look for one, right? Well, that's when you get a big problem, like cervical cancer. So that's definitely an issue. Cervical cancer is like the number 3 of the cancers that women have to worry about. So, in spite of this pap smear, which is a great screening tool. So you can have HPV for long periods of time and never know it. Like I mentioned, it can hide in the tissues. I've run support groups for women who've had HPV for basically since I was originally addressed my problem with HPV, which was back in 2000. And one story in particular that really sticks out in my mind is a really good example of this. There was a 60-some-odd-year-old woman who was in my group, and she hadn't been sexually active for many years. I don't remember if she was divorced or if her husband passed away, but for whatever reason, there was many years where there was no sex and that kind of thing. And then one time she came back from her pap smear and it was abnormal. She had an HPV diagnosis, and she was just so confused about how this could have happened. And rightly so. The issue is one of these viruses, like herpes. I'm sure you've heard with herpes, it can hide in the nerves and then come out in times of stress, or if you've had like with the oral herpes, too much sun can trigger an outbreak, stress, illness, that kind of stuff. The same thing. It's like your immune system is taking a hit. So I don't remember the details of her story. This was many years ago. There was probably some kind of, emotional, energetic hit, that took a toll on her well-being, on her immune system, and this problem cropped up. So it was very upsetting for her.
So thank you for listening, everybody. Stay tuned for our next episode of Tiny Teaching Topics, where we're going to go in deep on the latest developments in HPV testing and how this is going to change everything. This is how we can get a handle on the HPV epidemic. Millions of people are being diagnosed every year with HPV, and this testing tool gives us the ability to turn the tables on HPV. So join me to learn more. Take care, everybody, and we'll talk soon. Bye-bye.